is Dr. Shaun Patel, and I am a physician at Miami Skin and Vein in Coral Gables, Florida. We are trying to put together this educational video regarding the injection of dermal fillers, and we have this great patient here who's volunteered for the injection today. We're going to start this off by kind of evaluating her face, and I'm going to point out some of the things that I look for when I'm doing a facial rejuvenation procedure. Carly is going to be getting Botox and fillers, but this video is going to be mainly focused on fillers. So looking at Carly's face, I asked her before we began this video what it was that was concerning her, and I'm going to point out some of those things, and then I'm also going to point out some of the things that concerned me and that kind of stood out to me. So Carly was concerned about her forehead wrinkles. So Carly, can you raise your eyebrows? You can see that she has significant horizontal forehead lines. She was also concerned about frown, her glabellar complex, her frown lines as we like to call them, and a big smile. She was also concerned about some of her lateral canthal lines, what we call crow's feet. Her biggest concern, however, was the fact that she has these shadows under her eyes. And what I told Carly was that most likely these shadows are because of volume loss in her, what we call the tear trough. Carly, if you could turn down your head, if you look at her head, her face, she's kind of put it down for us, and what you can see is where my finger is, there is a loss of volume right there, and a loss of volume on this side as well. That loss of volume creates a divot, and the light hits that divot and creates a shadow, and that's what gives this kind of tired look to her face. And so what I'm going to show you is if we get rid of that divot, we're able to almost completely refresh her look. And what we're going to try to do is accomplish that by putting a little bit of filler right along the tear trough and getting rid of that transition that's causing that little bit of shadowing. In Carly's case, we're also going to focus laterally. Carly is a runner and a fitness guru freak, I guess I would say, and Carly has lost a lot of weight, and for that reason she's also lost a lot of fat in her face. And fat is kind of important in the face because it provides structural support to the face. Particularly as you get older, it becomes even more important because we start to lose collagen and elastin. So in her case, you get this almost kind of hollowed, deflated appearance to her face. And so what we're going to do is kind of augment with some filler along the zygomatic bone here and kind of give her a little bit more mid-face volume. This will also achieve a lift in her face, which will help with her nasolabial fold as well as marionette lines and sharpen up the corners of her mouth. You can see she's got a little bit of a nasolabial fold. She's got a superficial smile line, and you can see that the corners of her mouth are starting to slowly downturn. This can be an area of very important rejuvenation. A little bit of filler right there, support at the corner of the mouth can really improve her appearance. Other things that we've considered in Carly is she has a prominent mental sulcus, and we will probably be augmenting her chin a little bit with some filler, kind of just to sharpen, give her a little bit more proportion, and fill in some support anteriorly. Last thing on Carly, I'm just going to finish up at the end with the Botox. She did tell me Carly has some brow ptosis, and so there are a couple of ways to address the descent of the brow. And one of the ways is injecting Botox and lifting up the brow, but the other way to do that is to add some filler along the brow as well. And both of those may be options in Carly's case. I start the procedure off by cleaning the face. We use a product called ChloroPrep. Although the risk of infection with this procedure is extremely low, we try to make it even lower by using this cleansing tool in addition to alcohol. So during the first part of the injection, I just reassess the face and make sure there's no asymmetries or differences in proportion in the mid-face when you compare both sides of the face. I clean the skin with alcohol again before I inject, and I tack the skin up, lift the skin up along the zygomatic bone, and I inject the Voluma at the supraperiosteal plane. That's the plane right on top of the bone. It is an avascular plane, and it's a relatively pain-free injection. As you can see in this case, the patient is comfortable. During the injection, we've numbed her face with numbing cream, a topical numbing cream, and we've also iced prior to the procedure. So I just did the first deposition of the voluma, about a 0.1 cc's, and now I'm lifting back up again and injecting another 0.1 cc's into the midface. Allergan likes us to describe this as a V1, V2 injection. Voluma 1 and Voluma 2 points of injection. Although this is an extremely low-risk procedure, there are certain risks associated with the procedure, infection being one of them, which we minimize by sterilizing the skin, and the second being the risk of injection into a blood vessel, which is minimized by the fact that the injector should be cognizant of the relevant anatomy in the region. I am always palpating the infraorbital foramen, which is the location of the infraorbital nerve and vascular bundle, and I'm also cognizant of the vessels that are tracking along the lateral zygomatic arch and in the temporal fossa. In addition to knowing the relevant anatomy and avoiding those vessels during the injection, it's also really important to inject very slowly and at a very low pressure, because if you are in one of those vessels, it's absolutely important that you're not injecting with a high amount of pressure, which could result in retrograde flow of the filler material. So now we're going to shift our focus to treating the volume loss in the anterior cheeks and also treating the shadowing at the under eyes. We're going to use Juvederm Voluma to accomplish this, and I'm actually going to use a slightly different technique in this case. I'm going to be using a blunt tip cannula, which will help minimize bruising and which is a little more comfortable for the patient, and also I think in this area gives more natural results. So the first thing I'm going to do is lift up the soft tissue that I want to get under for the injection, and I'm lifting up the soft tissue, as you can see, and I'm introducing the cannula. I'm going to deposit the filler in the supraperiosteal plane. This is right on top of the bone, and also carry it all the way up, carry the cannula up to the tear trough. In this case, we're using approximately 0.5 cc's of Juvederm Voluma, which in this case was mixed with saline. Filler placement in the anterior cheek and tear trough can really re-inflate a patient's face. In this patient's case, she is somebody who exercises quite frequently and had, because of this, not much fat in her anterior cheeks and had a lot of hollowing at her under eyes. And I think by strategically placing this filler, we were able to give her a nice volumization of the face, a very natural, smooth result. So that's our approach to facial rejuvenation using fillers such as Voluma and Juvederm. In this patient, we augmented the cheeks and lifted up the face, also addressed the hollowing in the midface and the anterior cheek, as well as the under eye shadowing and volume loss. We used a combination of Juvederm and Juvederm Voluma, one of which is a slightly thicker filler to kind of lift up the skin, and the other which is great for general fine lines and wrinkles. Here at the end of the procedure, I'm really massaging the face and making sure that there are no nodules or bumps on the skin. There's no remaining bleeding. The patient will probably experience a little bit of bruising post-procedure, but she tolerated the procedure well. It's an extremely comfortable procedure with remarkable results.